So yes, hello everyone. So can you hear me? Is the screen clear so that we can start the session now? Those who have joined, welcome to the session of today's, that is infratemporal fossa. So let me know, can you hear me so that we can start the session now? Okay. Let me just check. Okay. So yes, today's session is about infratemporal fossa, myself Dr. Monalisa, and let's start with the session now. Yeah, Rangaraj, good morning dear. Abhishek, good morning. Yeah, and this is the NEET PG 2021 targeting, but it's also useful for the next aspirants and preparing for your university exam. So I have got a total of 8 years of teaching experience for the various competitive exam in the medical field, and I have done my MD anatomy from Armed Force Medical College Pune, and ANAT 10 is my referral code which can be used by you if you want to get 10% discount. Okay, now I also want you to give the information regarding Telegram group link of the Let's Crack NEET PG platform. So yes, this is the Telegram group link where you can join for the updates of all the upcoming sessions. You can be the part of these sessions. You will get the link of all the sessions which is taking place on the YouTube channel Let's Crack NEET PG, and also about the special session links will be provided there along with the information of the plus courses. Now, how to ask a doubt for in the session. So what you can see, what you can do, click on ask a button on the screen, and when you have got the app yourself, Unacademy app आप जब download करते you can also ask doubts. So thereafter you have to take a picture and choose from the gallery, crop the image, highlight the specific question, and thereafter select the correct question to which the question belongs. So this is how you can ask doubt in the sessions about any doubt which you find on the Unacademy platform. So I also want you to give information how you are going to be the part of special free sessions on the Unacademy platform. So like educators on the platform of Unacademy and also the Unacademy platform is giving a good opportunity for the students to be the part of special free sessions. Okay, so special free sessions is extremely useful for the students because if you compare its usefulness and priority above the YouTube session is that here you can also download the PDF notes after the completion of the session. Okay, so that is the positive point. So download the Unacademy app, find your goal as NEET PG. So you have to find your goal as NEET PG. Find your goal as NEET PG, and thereafter what you have to do, you have to search for me, that is Dr. Monalisa. So you will search for Dr. Monalisa. Okay, and you will get the link of all my free sessions. So you can join the free session. That will be extremely that will be very useful for you in cracking your entrance exam and also for your prof preparation. So I would like to tell you, this is my unlock code. For example, the students who have downloaded the Unacademy app for the first time, they have to use this code ANAT 10 for unlocking free sessions on the Unacademy platform. Got it? So this is how you can be the part of free sessions on the Unacademy platform. Now special class features, when we are talking about special class features, so it should be an interactive session. Okay, it is an interactive session where you can interact with the top educators of Unacademy platform. Polls are conducted with the learners, so you can have the polls which is conducted for the learners is very useful in regards to a healthy competition, and also you will know what is your weak area and which part of it should be paid more attention and you have to improve. So raise your hand and get your doubts clear right itself in the live sessions of Unacademy. Never miss a class. So this is a very useful feature of the Unacademy platform, where what happens if you start, for example, you start following me, so you will get the updates and you will get the notification of all my sessions which is taking place. Lecture notes. So what I have already told you that this is very important. For example, when you complete the session, when the session is completed, so after the completion of the live session, you can download the PDF notes of that session, Anywhere, anytime, read from the top educators of Unacademy platform. It will give you a classroom like interaction feeling, and it will be highly beneficial for you. So don't miss the special classes. And I also want you to know about the referral and unlock code, that is NAT10, which is can be used for 10% discount. Like, subscribe Let's Crack NEET PG platform of YouTube, and start following him. Use a referral code NAT10 for getting 10% discount. So if you want to be the part of free sessions, you can also use this code as an unlock code. But if you want to take any of Unacademy subscription of any of the field, you can use the code NAT10 and get 10% discount. Before starting the session of infratemporal fossa, I would also like to give you information regarding Bucks Bounty opportunities for the learners to report any inappropriate content in the video. Be the first one to report a particular issue to claim your prize. Report any inappropriate content and you win exciting prizes for it. So all the best, students. Satyajit, good afternoon. Satyajit, good afternoon. Okay, so let's start the topic of infratemporal fossa. So what I feel, I will give the notes. For example, when we are taking the sessions. So when I am taking the sessions on the YouTube, so you have to be attentive, so that you have to write the notes along with me. The important points, which is very important and should not be missed out in the topic, I will tell you. And also it is important that, for example, when we take a session on special classes, you can download the PDF, but here you have to attend the session live and write all important points, because PDF is not provided on YouTube sessions. Okay. So let's start with the session now. So when we are talking about infratemporal fossa, the first thing is that you should know the location. So exactly, infratemporal fossa is a space. It's a space which is located beneath the base of the skull. So where it is located? It is located beneath the base of the skull. Okay, so its exact location is beneath the base of the skull, and exactly it is lying between the side wall of the pharynx and the ramus of mandible. So the exact space which we are the exact space which is called as infratemporal fossa is located. I will show you that diagram also, don't worry. So that exact space is located beneath the base of the skull and exactly between two important landmarks, where it lies between the side wall of pharynx and ramus of mandible. So this is the exact location of the infratemporal fossa. It is important for us to know the boundaries of infratemporal fossa. Before that, let me slightly enlarge this diagram. Okay, so all of you see here, so I have slightly enlarged this diagram so that you can appreciate. This is the diagram showing infratemporal region. So yeah, so what we are seeing, we are seeing the, so exactly what it is showing. So let me write it. It is showing the area for just a minute. Infratemporal fossa. Okay, so exact location is showing infratemporal fossa, and I am just outlining the space which is shown with a dotted line. This is the region of infratemporal fossa. Everyone, can you see? This is the region of infratemporal fossa. Is it evident? Yeah. So let me slightly shade it with green color. This whole area which you are seeing is the region of infratemporal fossa, which is quite evident when we are seeing the space from the basal aspect or inferior aspect of the skull. Okay, so it is exactly located just in between the ramus of the mandible. Okay, so this part is the ramus of the mandible which you are seeing. This part is the ramus of mandible. So it is exactly located medial to ramus of the mandible, and this space is the infratemporal fossa, which is quite evident when we are seeing the basal aspect of the skull. Don't worry, another diagram from the Gray's Anatomy where I will explain the boundaries and your concepts will be more clear. Okay, so this is just showing the area from the basal aspect. So is it okay, everyone? Are you understanding? Let me know. Let me know, yes and all. You can type there. So let me first explain the boundaries and then I will write it. Don't worry, I will write the notes for you. So let me slightly enlarge this diagram. Yeah. So, so you can see here, if we talk about the space, so this is the lateral view. What is this view? This is the lateral view of the skull. in which, oh, thank you Satyajit. Okay, so this is the lateral view of the skull. This is the lateral view of the skull, where you can appreciate the space which is lying below, the space which is lying just lateral to the maxilla. Okay, so that is actually, when we talk about the maxilla, it is more anterior. So can you see here, if let me shade it, the maxilla part. So I am just shading the maxilla bone. Can you see here? This is the maxilla bone. Okay, so here this maxilla bone is the maxilla bone, slightly enlarge it. Yeah, so when we are talking about the maxilla bone, yeah, so when I am talking about the maxilla bone, exactly the infratemporal aspect of the maxilla bone, so this will be the infratemporal aspect of the maxilla bone, which is forming the anterior wall. So let me write here. This is forming the anterior wall. So infratemporal fossa, infratemporal region of the maxilla is forming the anterior wall. I will write it also. So yes, in this diagram it is quite evident that this is the anterior wall. Now ramus of the mandible is not shown. Okay, why ramus of the mandible is not shown? Because ramus of the mandible is removed so that you can get a overview of the infratemporal region. So ramus of mandible will lie, any idea? So ramus of the mandible which is removed, here ramus of mandible is removed. Why? Because so you can have the proper view of infratemporal region. So this structure is forming the lateral wall of infratemporal fossa. Infratemporal fossa का lateral wall बना रहा है. So what area we are seeing? We are seeing the area of infratemporal fossa. Got it? Infratemporal fossa. So ramus of the mandible is removed, and the blue color area which I have highlighted is the maxilla. Now pterygo, can everybody appreciate the pterygoid plate, lateral surface of pterygoid plate? So yeah, let me use this color. So I am just using pink color to highlight the pterygoid plate. See here, this is the lateral pterygoid plate. This is the lateral pterygoid plate. So this lateral pterygoid plate, when we are talking about lateral pterygoid plate, this lateral pterygoid plate is forming the medial wall of, it is forming the medial wall of infratemporal fossa. Got it? So anterior wall by the infratemporal surface of maxilla, laterally यहाँ पे ramus है, we have removed the ramus, and medial wall by the lateral pterygoid plate. Lateral pterygoid plate. Got it? Roof is formed by infratemporal surface of greater wing of sphenoid. So yes, let me okay, so I would like to use blue color. So this, let me just highlight this greater wing of sphenoid. This is the greater wing of sphenoid, and the lower aspect of greater wing of sphenoid is infratemporal surface of the greater wing of sphenoid. So this infratemporal surface of greater wing of sphenoid is forming the roof. So this is the roof. So ऊपर में क्या है, टॉप पे क्या है, ग्रेटर विंग ऑफ स्फेनॉइड का. सो स्फेनॉइड बोन का इंफ्राटेम्पोरल सरफेस है. गॉट इट? ओके. And so we have seen this, and in the lower aspect, if we talk about the floor of infratemporal fossa is open. Okay, so once more, lateral aspect, ramus of the mandible which has been removed. If you want to go into the infratemporal fossa, when you are going for the dissection of infratemporal region also, you have to just dissect out the ramus of the mandible. You have to break that bone, to go inside the infratemporal fossa. वहाँ पे anterior aspect में कौन सा bone है? Maxilla. Which bone is lying anteriorly? Infratemporal surface of maxilla. Okay, greater sphenoid bone का भी infratemporal surface is forming the roof, as we have seen. Laterally we have already done. Medially we have got lateral pterygoid plate as shown in the diagram. Medially there is lateral pterygoid plate. Okay, and posteriorly, so I didn't told you about the posterior aspect. So my dear aspirants, see here, this is the stelloid process. Let me use okay, let me highlight it with some other color so that you can appreciate here. Okay, so this is the stelloid process. Okay, this is the stelloid process, and the stelloid process of the temporal bone is forming the posterior wall. It's forming the posterior wall of infratemporal fossa. So everyone, is it okay? Are you understanding? Have you understood exact location in this lateral view of the skull? So I would like to write this boundary very clear for you, because it can come for your examination and it is also asked in your entrance exam of next and NEET PG 2021. Okay, so let's start with that. All of you please note down, write on the heading boundaries of infratemporal fossa. Boundaries of infratemporal fossa. So the heading is boundaries of infratemporal fossa. Now let me describe the important structures which we can see here and the important boundaries which is forming. So first thing which I want to write is the roof. So roof is formed by, anyone wants to Amol? Yeah, it's are you understanding? Great. So roof is formed by which structure? It is formed by infratemporal surface of greater wing of sphenoid. And my dear aspirants, I also want to tell that in the roof which is formed by the infratemporal surface of greater wing of sphenoid is having foramens, okay, which is forming its communication with the middle cranial fossa. So which two foramen is lying there? So please write down, two foramens are located. Yeah, absolutely right, Satyajit. He is absolutely right. It is the foramen spinosum and ovale. Very good. So sphenoid में foramen spinosum and ovale is lying, which is forming the communication with the middle cranial fossa. So I have just outlined the roof, and it is having two foramens. It is pierced by foramen ovale and foramen spinosum, and through this foramen it is forming communication with the middle cranial fossa. So yes. Now moving on to the next, that is medial wall. Medial wall is formed by, if you remember in the diagram I have shown you, lateral pterygoid plate of sphenoid bone. Lateral pterygoid plate of sphenoid bone. Got it? Okay, so roof and medial wall has been done. What is next is the lateral wall. Lateral wall is formed by ramus of the mandible. Floor floor is open, please note down, floor is open, anterior wall and posterior wall. So floor is open and anterior and posterior wall, I have to mention it. Okay, so I would like to mention here itself, anterior wall and that of posterior wall. This is the anterior wall and this is the posterior wall. Got it? Anterior wall and posterior wall. So anterior wall and posterior wall. Anterior wall is formed by infratemporal surface of maxilla. Maxilla, yeah. And the posterior wall is formed by stelloid process of temporal bone. Stelloid process of temporal bone. So got it everyone? Is it clear? So we have done with the boundaries. We have done with the boundaries of infratemporal fossa. We have seen the roof, medial wall, lateral wall, floor, anterior wall and the posterior wall. Next important point which is often asked for your MCQ session is the communication which is found, how the infratemporal fossa is communicating with other important structures. So let's have a discussion of the communications of infratemporal fossa. So let's start with that. Okay, so let me explain it firstly and then I will also show you diagram, and so let's write the next heading, communications of Infratemporal fossa. Communications of infratemporal fossa. The communications are, when we are talking about the above communication, so infratemporal fossa on the above aspect, it forms a communication with the temporal fossa. So it is communicating with which fossa? Temporal fossa, through a gap between, so the gap is lying between which structure? The gap is lying between zygomatic arch and middle. So what happens? It will communicate with the temporal fossa through a gap which is located between zygomatic arch and that of middle cranial fossa. And as I told you, in the upper aspect, middle cranial fossa forms a communication with infratemporal fossa containing two foramens, foramen spinosum and foramen ovale. I am writing in short form, FS and FO, that is foramen spinosum and foramen ovale. Now coming to the lower aspect communication. So when I am talking about the communication which is lying in the lower aspect, it is continuous in the lower aspect with the spaces of the neck. It is continuous in the lower aspect with spaces of neck. This spaces of the neck is located lateral to pharynx. It is located lateral to pharynx. Got it? So we have got the communication above, we have got the communication below. Above it is communicating with the middle cranial fossa through foramen spinosum and foramen ovale. Below with the spaces of the neck lateral to the pharynx, and one of the most important communication which is very important is with the pterygopalatine fossa. The exact communication route is through pterygomaxillary fissure. Okay, so I would like today to take 2 sessions. I will also complete the topic of pterygopalatine fossa. So here you can write that information. It communicates, the third communication is it communicates with pterygopalatine fossa. And my dear aspirants, pterygopalatine fossa is communicating. So the two structures, that is infratemporal fossa and that of pterygopalatine fossa, is forming a communication with each other via pterygomaxillary fissure. Via pterygomaxillary fissure. Got it, everyone? The communication is via pterygomaxillary fissure. One more communication is very important, which I don't want to miss out. So I would like to accommodate here itself. Write down the fourth communication. The fourth and the very important communication of infratemporal fossa is with the orbit. So it is also forming a communication with the orbit. And what is the route? So it forms a communication with the orbit through inferior orbital fissure. Through which structure? Through inferior orbital fissure. So is it okay? So clearly here we have done with all the communication. Okay, yeah, so clearly here, so the first you can see here the communication is the orbit. The communication is the orbit with the inferior orbital fissure. Above it is forming a communication with the temporal fossa. Okay, below it is forming a communication with the lateral neck space, and pterygopalatine fossa, it communicate via pterygomaxillary fissure. Pterygomaxillary fissure. So my dear aspirants, we have done with the communication of infratemporal fossa. Next important point which has to be known to you is the content which is lying inside infratemporal fossa. So see here, you can see this flow chart which is also showing the communications. The communications are infratemporal fossa has been summarized here. Through a gap which is lying deep to zygomatic arch, it is communicating with the temporal fossa. Through pterygomaxillary fissure, it communicates with pterygopalatine fossa, and the pterygopalatine fossa also forms a communication with the nasal cavity, and that communicating route is called as sphenopalatine foramen. That communicating route is called as sphenopalatine foramen. Through inferior orbital fissure, it is communicating with the orbit. It is forming communication with the orbit. So got it, everyone? Okay, So now, thereafter I just I will come up with the contents. So before that you write the contents, and then we will show the important contents which I want to specify, and I will go into details of it. So firstly, write down what are the important contents of infratemporal fossa. The contents of infratemporal fossa is, it contains an important terminal branch of external carotid artery. A very important artery is located in this content. So what happens if we talk about infratemporal fossa? Blood vessels में maxillary artery is very important content. So first is blood vessels. In this blood vessels, maxillary artery, a terminal branch of external carotid artery, is an important content. Also maxillary vein is lying there as a content, and pterygoid venous plexus, okay. So these are the blood vessels content, Other than that, it contains muscles. So few muscles of mastication. So already I have done with the topic of muscles of mastication's detail in other topics. So those who want to revise origin, insertion, action of these muscles, they can see in the muscles of mastication topic. So the muscles lying are lateral pterygoid muscle. The muscle lying here is lateral pterygoid muscle. Medial pterygoid muscle, and also tendon of temporalis muscle, Got it? Tendon of temporalis muscle, lateral pterygoid muscle, and that of medial pterygoid muscle. Yes. So what else? Anything else which I have missed out? Yes, I have missed out the nerves. Okay, so the third content which I want to elaborate is the nerves, which is residing inside infratemporal fossa. Which nerves? Anyone want to give the answer? Which nerves resides? Anyone? Which nerve resides in the infratemporal region? Which nerves? Mandibular nerve, coda tympanic nerve, coda tympanic nerve, and one more is the ganglion, otic ganglion. Got it? So blood vessels residing, muscles residing, and nerves residing. Okay. So the list is like this. That is the structures which is residing in the infratemporal fossa. Blood vessels में maxillary vein and artery, pterygoid venous plexus, muscles में lateral medial pterygoid and the tendon of temporalis muscle. The nerves is the mandibular nerve, coda tympanic nerve, and the otic ganglion. So my dear aspirants, like muscles we have already covered up, and the topic of otic ganglion. So I would like to take a session which is called as the ganglions of head and neck region, which I will take a session in the coming month. So today I would like to elaborate about maxillary artery and mandibular nerve right here. So, and also the maxillary vein and pterygoid venous plexus. So let's see the details of these structures residing in the infratemporal fossa. Okay. So yes. The first thing is about maxillary artery. So let me firstly give an introduction about maxillary artery, and then I will come up with this diagram. So firstly, all of you please write down the introduction part. Write on the heading maxillary artery. Maxillary artery, a very important content of infratemporal fossa, and it is very important topic for your NEET PG exam, NEET PG 2021. Branches, location, from which part of maxillary artery, it's quite important for you to know. So actually if we consider its origin, maxillary artery is the larger terminal branch of external carotid artery. So it's the Satyajit maxillary nerve. No, mandibular nerve, dear. Mandibular nerve is maxillary nerve. Mandibular nerve is the content for the infratemporal region. Okay, mandibular nerve, maxillary nerve. We have, if you want to study, we have to go for pterygopalatine fossa in detail. If you want, I will take a session on maxillary nerve also. Okay, Satyajit. Today we will study mandibular nerve in brief. So I would like to point the crux point. I know that students can't memorize. One thing is that too much of information also loaded will help you not in targeting your exam or your university exam next or NEET PG 2021. What is the very important crux point which is very important for your entrance exam, for your university exam is very important. So that is what I am going to explain. So maxillary artery is the larger terminal, it's the large terminal branch of external carotid artery. It's a large terminal branch of external carotid artery. So where does it arises? So exact location is, its origin occurs behind the neck of the mandible. It is arising. So write down, it arises behind the neck of mandible. It arises behind the neck of mandible and runs horizontally forwards up to lower border of lower head of lateral pterygoid muscle, lower head of lateral pterygoid muscle. Okay, so this is all about the origin point. And what happens actually, this lateral pterygoid muscle, if I am talking about this lateral pterygoid muscle, it is again considered to be the key muscle of infratemporal region. Okay, why key muscle of infratemporal region? Because this is the muscle which is dividing the maxillary artery into three parts. It is dividing it into three parts, first, second and third. Okay, maxillary artery is divided into three parts by the lateral pterygoid muscle, first, second and third. Okay, so write down. So before that I would like to show, I would like to write, but before that I would like to show this diagram. So my dear aspirants, what you can see here clearly, okay, that this is a maxillary artery which is originating from the source of external carotid artery, larger terminal branch. Now you can clearly see that it is having third part, second part and first part. So firstly what you can have to highlight here is the two heads of lateral pterygoid muscle. So you can see here, this is the outline which I am showing you is the lateral pterygoid muscle. Okay, so that is lateral pterygoid muscle and this is the mandible neck. So the first part, if you will see, this is the neck of the mandible which has been dissected out. The first part is exactly lying between the neck of the mandible till the level of lower head of lateral pterygoid muscle. So see here, this is the lower head LP, this is the lower head for lateral pterygoid till this part. This is the first part. This is the first part of maxillary artery. Now the second part will lie in relation. This is the second part, and here you can see the second part will lie, either it can go deep to the lateral pterygoid muscle or it can be running over the lateral pterygoid muscle. What about the third part? The third part of the maxillary artery is traversing inside. Actually it passes through pterygomaxillary fissure and it traverses inside the pterygopalatine fossa. Okay, pterygopalatine fossa. So let me write all these points for you. Write on the heading, parts of maxillary artery, parts of maxillary artery. First is, the first part is also called as, anyone? First part is also called as mandibular part of maxillary artery. The first part is also called as mandibular part of maxillary artery. Now coming to the description of it. So if we talk about the description, it is, the first part is extending from the origin to lower border of lateral pterygoid मसल, lateral pterygoid muscle के lower border तक extend हो रहा है. The first part, it starts from the origin and is extending from the close to the neck of the mandible, and then it is traversing till the level of lower border of lateral pterygoid muscle. It lies, so what you can say, exact location is, it lies between neck of mandible, laterally, and sphenomandibular ligament medially. Sphenomandibular ligament medially. So this is the whole explanation of the first part. So here we can see here that exact location is between the neck of the mandible, which is lying laterally, and sphenomandibular ligament is lying medially. This is all about the first part. Now let's see the exact location of the second and the third part. Let's come up with the explanation of second and the third part of maxillary artery, and thereafter we will see the individual component and the parts of maxillary artery and the important branches from individual parts of the maxillary artery. Okay, so now moving with the second part of maxillary artery. Okay, second part of maxillary artery. So when we are talking about second part of maxillary artery, it is also called as the pterygoid part. What is the other name which is used for the second part? It is also called as the pterygoid part of maxillary artery, and it is running from the lower border of lateral pterygoid muscle to the upper border of, so what you can say, to the upper border of the lateral pterygoid muscle. So in that relation, it is, why it is called as pterygoid part, because it is exactly related with the lateral pterygoid muscle. Either it can it can traverse from lower part or lower head of lateral pterygoid muscle to upper head. In that context, it can either be deep to the lateral pterygoid muscle or it can be superficial to lateral pterygoid muscle. So write down, it is traversing from lower border to upper border of lateral pterygoid muscle, and in this contents it can be either deep or superficial to lateral pterygoid muscle. Okay, now coming to the third part, thereafter moving with the third part of maxillary artery. So write down, third part of maxillary artery. Third part of maxillary artery is given a name, that is, it is also called as pterygopalatine part. Pterygopalatine part. Why pterygopalatine part? Because it is traversing in the pterygopalatine fossa. So it is extending from upper border of, it is extending from the upper border of lateral pterygoid muscle pterygopalatine fossa and entering into pterygopalatine fossa. So this is the third part. Now we have done with the parts of the maxillary artery. Next important point is to know the branches from each component of maxillary artery. So let's move with that. Yeah. So important branches has been shown in this diagram. Okay. So actually it's easy to memorize. How I will tell you. The branches from the second part is all muscular. So the branches will be given to the adjoining muscle which is lying in the vicinity of the second part of maxillary artery. So if we summarize, we have got 5 branches from the first part, we have got 4 branches from the second and 6 branches from the third part. So yes, now if we talk about here, yeah, so this is the maxillary artery which is shown. Slightly enlarge it, is it okay? Yeah. So it is giving following branches, very important branches are given. So see here, this is the origin point of the maxillary artery, and important branches from the first part is anterior tympanic, the middle meningeal artery, the accessory middle meningeal artery, okay, and inferior alveolar artery. These are the branches from the first part. One more is there, that is the auricular. Okay, let me see, the auricular has not been shown here. So we have got also the deep auricular. So also deep auricular. These all branches are the first part. Now second part, as I told you, all the branches are muscular. So let me tell you about the muscular. So muscular branches are deep temporal to the temporalis muscle, pterygoid branch to the pterygoid muscle, masseteric branch to the masseter. This is also pterygoid, and this is buccal branch to the buccinator muscle. So all these branches which I have highlighted in the pink color are the branches from the second part. Now moving to the third part, important branches are, let me use green color. Important branches are infraorbital, posterior superior alveolar, okay, and okay, so in so these are the branches and which will go into here. Also we have got the anterior deep temporal, okay, so a posterior superior alveolar, infraorbital, and one is the sphenopalatine. So that branch, sphenopalatine branch, is the continuation of maxillary artery. Don't worry, I will write the name of each individual part. So this diagram is showing important branches of maxillary artery, and we have to remember all the branches of the maxillary artery, important branches including the parts and the branches. So I will write it, don't worry. So write down here the heading, branches of maxillary artery. Okay, so when we are talking about the branches of maxillary artery, so first write branches from the first part. So first heading will be first part branches, first part branches, branches of the first part. So first part branches are how many? As I told you, 5. The important branches are deep auricular, artery, anterior tympanic artery, middle meningeal artery, accessory middle meningeal artery, and inferior alveolar artery. Okay, these are the 5 branches of maxillary artery. So let me give you certain details about each of its component. So yes, let me start with the deep auricular. So when we are talking about deep auricular artery, okay, when we are talking about deep auricular artery, it passes upwards and backwards, and it will enter into external acoustic meatus. It enters into external acoustic meatus, pierces the floors, and actually it is giving blood supply. It is supplying with structure. It is giving blood supply to external acoustic meatus and the outer aspect of tympanic membrane. Outer aspect of TM. What is TM? Tympanic membrane or eardrum. So it is giving blood supply to the outer aspect of tympanic membrane or eardrum and giving blood to external acoustic meatus. What about anterior tympanic artery? Anterior tympanic artery will go into tympanic cavity or middle ear cavity. So yes, it is giving blood to the middle ear cavity and it will pass through pterygotympanic fissure and give blood to inner aspect of tympanic membrane. So exactly it is giving blood supply, it is going inside tympanic cavity. It is going inside the tympanic cavity, through which gap, through pterygotympanic fissure, through pterygotympanic fissure. It will traverse through pterygotympanic fissure and will supply the inner aspect of, TM. What is TM? Tympanic membrane. So it is giving blood supply to inner aspect of tympanic membrane. Middle meningeal artery, a very important artery clinically also. When we are talking about, actually middle meningeal artery is the largest branch. It is the largest branch of maxillary artery. It's the largest branch of maxillary artery. And my dear aspirants, I have included so many times MCQs regarding this middle meningeal artery. Actually, when we are talking about middle meningeal artery, it is traversing through the foramen spinosum. So it passes through the foramen spinosum of the middle ear cavity. It passes through foramen spinosum of the middle ear cavity, and exact location, if we talk about the exact location, it is exactly located in between the dura and the skull. So it is lying outside the dura mater. It is located outside the dura mater. It is located outside the dura mater and it lies between the dura mater and the skull, and it has got two branches. So two important branches are there of the middle meningeal artery. The two important branches which the middle meningeal artery gives, I am writing in small, A and P. So A and P means anterior is also called as the frontal trunk and the posterior is also called as the parietal part. So it is dividing into anterior and that of the posterior aspect. The anterior component of middle meningeal artery goes towards the bony landmark that is called as pterion. So this anterior component will reach the area of pterion where the four bones are meeting. Which four bones are meeting? Squamous part of the temporal bone, the greater ring sphenoid, the frontal bone, okay, the parietal bone, and all these bones are meeting, and there is an H-shaped suture like this at the lateral aspect of the skull where the frontal trunk of the middle meningeal artery is located. And at times, if there is a direct blow on the lateral aspect of the skull, it gets bleeding. Blood will be bleeding from this trunk and it will lead to epidural hematoma. That condition is called as epidural hematoma. So it can lead to epidural hematoma. So these are basic clinical important points of the middle meningeal artery. So many times before also I have catered some MCQs regarding this point. Accessory middle meningeal artery. When we are talking about accessory middle meningeal artery, it is passing through foramen ovale. It is passing through, okay, it is passing through FO. I am writing what is FO. It is passing through foramen ovale, foramen of the middle cranial fossa, and this is supplying the meninges and the structure of infratemporal fossa. So what is it? It is supplying the structures of infratemporal fossa and the meninges of brain. So this is supplying inferior alveolar artery. Inferior alveolar artery enters the foramen, that is mandibular foramen. It enters the mandibular foramen. It will enter the mandibular foramen of the mandible. It will enter the mandibular foramen of the mandible. Then it will traverse through the mandibular canal and it will emerge out through the mental foramen. So it will emerge out through the mental foramen. It will emerge out through the mental foramen and will give two branches. One is incisive branch and the other is mental branch. So done. In short, we have done with the topic of, so slightly enlarged. Okay. So in short, as you can see here, we have done with the topic of all the important branches of the first part. So let's move on to the next. So After that, let's move on to the next, that is the okay, let's move on to the second part, important branches. Second part, important branches. Okay, so write down the second part. Branches of second part of maxillary artery. Branches of second part of maxillary artery. It's very easy to remember the branches of second part of maxillary artery. Why? I will tell you, because all the branches are muscular branches. The second part of maxillary artery is giving muscular branches, so it will supply the muscles lying in the vicinity of the second part of maxillary artery. And very nicely you can remember the names of these muscular branches. We have got 4 branches. So we have got how many branches? 4 branches from the second part. We have already seen the 5 branches. So we have got 5 branches from the first part. We have already done the discussion of that. So now let's move on to the 4 muscular branches from the second part. The branches are deep temporal artery. My dear aspirants, the deep temporal arteries are generally 2 in numbers. Anterior and posterior deep temporal arteries are there, which is supplying which muscle? It is supplying the temporalis muscle. They are giving blood supply to temporalis muscle. Other than that, we have got pterygoid branches. So when we are talking about pterygoid branches, it is giving blood supply to the medial and the lateral pterygoid muscles. Medial and lateral pterygoid muscles. Deep temporals are supplying temporalis muscle. So other than that, also the masseteric branches. What do you mean by masseteric branch? Masseteric branch is supplying the masseter muscle, quadrilateral muscle lying on the outer aspect of the ramus of mandible, one of the important muscle of mastication. And the 4th branch is the buccal branch. So buccal branch will supply which muscle? It will supply the buccinator muscle. It will supply the buccinator muscle. Now done with this, now moving on to the branches of third part. So third part is giving 6 important branches. So write down branches of third part of maxillary artery. Branches of third part of maxillary artery. So branches of third part of maxillary arteries are following. Important branches: sphenopalatine artery. Sphenopalatine artery. So sphenopalatine artery is actually considered to be, sphenopalatine artery is considered to be terminal branch of maxillary artery, and it is also called as nasopalatine artery. So it is also called as nasopalatine artery, and this artery is the terminal branch of maxillary artery. This artery is terminal branch of maxillary artery. This artery is terminal branch of maxillary artery. Now coming to the second one, descending palatine artery. Descending palatine artery is giving 2 important branches. What are they? It is giving greater palatine and that of lesser palatine artery. Greater and that of lesser palatine artery. The third important branch is infraorbital artery. Fourth important branch is posterior superior alveolar artery. Posterior superior alveolar artery. Posterior superior alveolar artery. Got it? Posterior superior alveolar artery. And the next is artery to pterygoid canal. And the pharyngeal artery. So these are the 6 important branches. These are the 6 important branches. So please note down. These are the 6 important branches of third part of maxillary artery. What I would like to write here, actually infraorbital artery again is giving 2 important branches. Write on that name. बहुत बार confusion होता है branches में, so you should know which artery is a branch of which artery is the source. So infraorbital artery is giving 2 important branches. One is middle superior alveolar artery and the other is anterior superior alveolar artery. And here you can see, when we are talking about posterior superior alveolar artery, it's a direct branch of third part of maxillary artery, but middle and the anterior superior alveolar arteries are the branches of infraorbital artery. So yes, these are the 6 branches. So yes, Abhishek, Shri, Rangraj, Satyajit, Amol, everyone, so are you understanding? So yes, we have done with an important artery. Next, what is very important for you is to know the maxillary vein and pterygoid venous plexus, and then we will move on with the nerves. So I would like to show you this diagram of maxillary vein. Okay, so here you can see this is the maxillary vein which has been highlighted. Okay, so maxillary vein and pterygoid venous plexus, these are the 2 important vein content which is lying in infratemporal region. When we are talking about maxillary vein, it is having a short trunk and it is accompanying the first part. So it is lying very close. If I talk about, so this maxillary vein is accompanying, okay, great. So this maxillary vein is accompanying the first part of maxillary artery, lying very close to the first part of maxillary. See here the location also. Okay, and one of the important component is that it will having a short course accompanying the first part of maxillary artery, and it is formed by confluences of the veins which is surrounding it and it will join with the superficial temporal vein. See here, this maxillary vein joining with the superficial temporal vein and leads to the formation of retromandibular vein. So you can see here, this is joining with the superficial temporal vein and it will lead to the formation of retromandibular vein. Got it? It is linked to the formation of retromandibular vein. Okay, so yes, let me just write okay, so let me write few important points and then I will also give you the details of pterygoid venous plexus. Write on the heading maxillary vein. Maxillary vein is having short venous trunk. It is having short venous trunk. Maxillary vein is having short venous trunk accompanies the first part of maxillary artery. The first part of maxillary artery formed by confluences of veins from pterygoid venous plexus. Okay, pterygoid venous plexus. Okay, and the exact location where it is lying, so it passes between the neck of the mandible. It passes between the neck of the mandible and sphenomandibular ligament, same as the first part of maxillary artery. So it passes between sphenomandibular ligament and neck of mandible. This space, this neck of mandible, this is the exact location of the first part of maxillary artery, which is corresponding to maxillary vein. Next important point is inside the parotid gland. What happens? This maxillary vein, please note down, maxillary vein residing inside the parotid, when it is residing inside the parotid gland, when it is residing inside the parotid gland, the maxillary vein joins superficial temporal vein, as I have shown in the diagram also, it will join with the superficial temporal vein. And what is the resultant vein form? The resultant vein form is RMV. What is RMV? Retromandibular vein. Retromandibular vein. So this is how the retromandibular vein is formed, and is in the venous drainage of the face and scalp, what I have discussed. Retromandibular vein having two components, anterior and posterior. Anterior will join with the facial vein and the posterior will drain and form the external jugular vein. So this is how we have already done that in the scalp and the face region. I would like to give you certain brief information and details of the pterygoid venous plexus. Okay, so see here, this is the pterygoid venous plexus. Pterygoid venous plexus is actually the network of small veins lying within the pterygoid muscle. So you can see here, it's actually a network of this pterygoid venous plexus is actually a network of small veins which is having communication. It forms communication with the cavernous sinus via emissary vein as shown in the diagram, with the orbit via inferior ophthalmic vein, and with the facial vein as you can see in the diagram with the deep facial vein. So in this diagram, you can clearly see the communication of pterygoid venous plexus. It is forming communication with the orbit, and it is forming communication via inferior ophthalmic vein via orbit, communication with the facial vein via deep facial vein, and communication with the cavernous vein via emissary veins. Okay. So it's actually why it is important. Many veins are there. There is this forms a potential route of infection traversing because they have got no valves. So this is exact. In this cadaveric image, this is the location of pterygoid venous plexus. When we go for dissection also, we have to strap out the component of pterygoid venous plexus veins. We have to remove. Why? For a better picture of the maxillary artery and its branches. This is how we proceed for the dissection part. So let's write about pterygoid venous plexus, few important points, and then we will move with the mandibular nerve. Pterygoid venous plexus. Yes, Satyajit, thrombosis. Yes. At times it forms a infection route because the valves are not there, and cavernous sinus thrombosis is a very important clinical aspect. So these veins are also forming a route of infection. Pterygoid venous plexus, actually it's a network of small veins. It's a network of small veins. Where it is located, next important point is the location. Where it is located is lying within the lateral pterygoid muscle. This is the reason why lateral pterygoid muscle is called as the key muscle. Many important structures are lying inside the lateral pterygoid muscle. And the next important point is that it is forming certain communication. So please write on the heading, communication of pterygoid venous plexus. So let's write few important points about the communication. So it is forming communication, three important communications. So we will discuss the three important communication which was seen in the diagram also. It is forming communication with inferior ophthalmic vein, what is the route? The route is via inferior or infraorbital foramen. Okay. Cavernous sinus, so cavernous sinus communication is via emissary vein. This emissary vein will pass through foramen ovale, foramen visualis, and all these foramens which is located in the yes, peripheral heart. Yes, Satyajit Behra, that is important. This is the reason it is also called as the name which is given to pterygoid venous plexus is the peripheral heart. Yeah, absolutely right. Yeah, absolutely right. That is also forming important communications, important route of communications. Facial vein, it also forms communication with facial vein via deep facial vein. Okay. Now next important point which we will study is an important content is the mandibular nerve. So firstly let me show you a diagram for this. So yeah, now clearly as you can see in the diagram, when we are talking about the mandibular nerve, what you can see, this is the trigeminal ganglion. So actually three important. So we can see here, this is the trigeminal nerve having two components, the motor and the sensory, and three important branches are from the trigeminal nerve. Three important branches from the trigeminal nerve or divisions occurs. One is the ophthalmic as shown in green color, then the maxillary one, and the third one is the mandibular nerve. So here mandibular nerve is the largest. It is the largest component or division of trigeminal nerve, and it is of mixed variety having both the sensory and motor component. It's important nerve of the first pharyngeal arch, and it gives innervation to the muscles of mastication. So write on the introduction about mandibular nerve. Mandibular nerve. Mandibular nerve is the largest division of trigeminal nerve. It's of mixed variety. It is of mixed variety having both sensory and motor component. Having both sensory and motor component. It is giving innervation to muscles of mastication, and it is the nerve of first pharyngeal arch. It's the nerve of first pharyngeal arch. It's the nerve of first pharyngeal arch. Got it everyone? Now next what I want you to explain the mandibular nerve, a very important component lying in the infratemporal region. Actually the question which has been come as a previous year question for the NEET PG 2021 and important for your next examination is to know the different parts. So actually mandibular nerve is having the trunk, it is having anterior division and posterior division. You have to know the branches from each part of the mandibular nerve and where it is traversing. So yes. So if we talk about the course of mandibular nerve, it begins in the middle cranial fossa. It begins in the middle cranial fossa and it has got two roots. Mandibular nerve is having two roots. It is having sensory and the motor roots. It is having the sensory and the motor root. Now my dear aspirants, the larger is the sensory component, and so the large component is the sensory one and the motor is the small, and these two components will traverse through foramen ovale. These two components will traverse through foramen ovale, and just at the point where it is exiting in from the foramen ovale, at that point it will join to form the trunk of mandibular nerve. It will join to form the trunk of mandibular nerve. And you have to know, so what are the direct branches from the trunk of mandibular nerve? So yes, so I would like firstly to show this. This is a diagram, this is a schematic diagram to show you the branches of mandibular nerve. So here I would like to show trigeminal ganglion, the sensory and the motor, then is the formation of trunk of mandibular nerve. As you can see, this is the trunk of mandibular nerve. Now from the trunk, the important branches which is given is, from the trunk is one is the nervous spinosum, which is shown here. This is the branch from the trunk. This is the first branch, that is nervous spinosum, and you can see here it is traversing in upward arc. So it is having a recurrent course, and nervous spinosum is a meningeal branch of the mandibular nerve. The other is nerve to medial pterygoid. The second branch from the trunk is nerve to medial pterygoid, and what you can see, this is giving innervation to these muscles, tensor tympani, tensor palatini and medial pterygoid. So these are the two branches from the trunk. These are the two branches from the trunk. Now I would like, firstly I would like to show you all the details of mandibular nerve in this diagram, and then I will write it for you, don't worry. So now let me tell you about the anterior and posterior divisions of the mandibular nerve. So if we talk about the posterior one is giving auriculotemporal nerve. As you can see, auriculotemporal nerve is encircling, as you can see here, it is encircling which artery? Middle meningeal artery. The other branches are lingual nerve and inferior alveolar nerve. So these three, 1, 2 and 3, these three are the branches of posterior division of these three. So let me write these three, P for posterior, these three are the branches of posterior division of mandibular. So basically it is sensory, but inferior alveolar nerve will also give one motor branch, mylohyoid nerve, nerve to mylohyoid muscle. So this is the motor branch of inferior alveolar nerve. Okay, when we are talking about the branches from the from the anterior division is mainly motor. So important branches which is given is the motor. The important branches is masseteric nerve to masseter muscle, deep temporals, nerve to lateral temporal. These are the three branches which are the motor branches. Only one sensory it gives, that is the buccal one. Okay, so only one. So P, what we can write, A for anterior, and we can see major branches from the anterior division is motor, only one sensory, that is buccal, that is the buccal nerve. Okay, so let me write it in brief and then we will be done for the topic. So let's start with the just the branches so that you will not confuse afterwards. So write down branches from the trunk of mandibular, branches from the trunk of mandibular nerve, branches from the trunk of mandibular nerve. So if we are talking about the branches from the trunk of mandibular nerve, it is giving following two important branches. The first important branch is nervus spinosum. Nervus spinosum is actually traversing along with middle meningeal artery. In which foramen? It is traversing in foramen spinosum. It is traversing in foramen spinosum along with middle meningeal artery, and it is basically giving it is having a recurrent course. As you have seen, it is again having a recurrent course and then going into the middle cranial fossa. So it is having a recurrent course. It is giving meningeal branch. It's a meningeal branch of mandibular nerve, which is supplying which part? It is supplying the dura mater. Meningeal है तो dura mater को supply करेगा. It is giving innervation to dura mater of middle cranial fossa, MCF, middle cranial fossa. Got it? Now the second branch is nerve to medial pterygoid. Nerve to medial pterygoid. This is the second branch from nerve to medial pterygoid. This is the second branch. This is the second branch which is given from the trunk, and it is supplying following muscle. It is giving innervation to following muscle. It is supplying medial pterygoid muscle, tensor palatini muscle, and tensor tympani muscle. Okay, so we have done with the branches of the trunk. Next is to know the branches of the anterior and the posterior division. So write down branches from anterior division. Branches from the anterior division of mandibular nerve. So as I told you, the anterior division branches are mainly muscular, and the important branches given to the muscles are masseteric nerve given to the masseter muscle, supplying mainly the masseter muscle. Deep temporal nerves are supplying the temporalis muscle. Lateral pterygoid, you can say nerve to lateral pterygoid, which is supplying the lateral pterygoid muscle. So these are the three important branches, muscular branches. As I told you, one is the buccal one, this is the sensory. Buccal nerve is the sensory branch. So buccal nerve is the sensory branch from the anterior division of mandibular nerve. This is the sensory branch, and the buccal nerve is supplying. Actually, this buccal nerve is giving, it's a sensory branch, and it is giving sensation mainly to sensory supply to the cheeks, the gums, the lower jaw till the level of second molar, premolar tooths. Got it? Now moving on to the branches of an posterior division. So write on the heading, branches from the posterior division. Branches from posterior division of mandibular nerve. I also want you to tell that after completing this topic, again from 2 o'clock, next topic which I will start is the topic of pterygopalatine fossa. So students can join me live for that. So branches from posterior division is, it gives auriculotemporal nerve. So now if you have seen the diagram, this auriculotemporal nerve is encircling which artery? Anyone? It's encircling which artery? Anyone? It is encircling which artery? It encircles middle meningeal artery. It encircles middle meningeal artery, and it is supplying structures like tragus, TM joint. It is giving secretomotor fibers to parotid gland. The second branch is lingual nerve. Now lingual nerve is actually giving secretomotor fibers to submandibular gland and that of sublingual, and it is supplying the gums and the lower, it is also sensory, lower or the floor of mouth, lower part of the floor of mouth. The third branch is inferior alveolar. So the third branch is inferior alveolar, and this inferior alveolar nerve, if we talk about this inferior alveolar nerve, it is giving one of its it's traversing through the mandibular foramen, traversing the mandibular canal, and it is giving one of its branch. That branch is the muscular component, that is nerve 2 mylohyoid. It is giving nerve 2 mylohyoid, which is the muscular component of inferior alveolar nerve, and it also gives dental branches traversing through mandibular foramen. So when we go for dissection of this region also, we just we will see this nerve traversing through the mandibular canal and mandibular foramen, and above the level of inferior alveolar nerves lies the lingual nerve. So basically what you can see, the branches are sensory, auriculotemporal, lingual, inferior alveolar. Only one branch is motor, which is a branch from inferior alveolar, that is nerve 2 mylohyoid, that is nerve 2 mylohyoid. Okay, so everyone, are you understanding? Now my dear aspirants, before ending the session, I would like to give you the information that how you can see the special free sessions. So tomorrow also I will take the special free sessions on the Unacademy platform, so do present there. So okay, tomorrow evening, okay, and just now from 3 p.m. I am starting with pterygopalatine fossa, but tomorrow evening I am taking special sessions on the Unacademy platform, that is 6 p.m. session will be there, and also 7 p.m. session will be there. That will be of MCQ session, so quiz of MCQ session. So do join, use the code NAT10 to get 10% discount, and also can be used as a unlock code. You can unlock my session and attend my free sessions on the Unacademy platform, that is taking place at the 6 p.m. and 7 p.m. is the timing. Now before completing the session, it is important for me to give you certain important points about the plus subscription, benefits of joining the plus subscription or taking the plus subscription of Unacademy. So you can access both live and recorded version. So you can be present for all live sessions for your targeted exam of all 19 subjects in a very systematic way. Always the Unacademy platform, which is India's largest online platform, is giving us the opportunity to interact on the free session, but it is not in a structured way. All the 100% can't be become free, as we know that many of the things are on the free platform. But if you want to compete for your entrance exam in a very systematic way, want to study with the top educators of the medical stream, so you have to take the plus subscription, where all the 19 subjects will be completed in a targeted way. You will get mentorship of the top educators, and they will help you to get your dream subject or dream rank, and you can study from your device of choice. The other important and a very useful component about the plus subscription is that you can access more than 25,000 MCQs on the platform of plus subscription of Unacademy, which is formed by on the latest pattern of examination by the top educators of Unacademy platform, and a detailed explanation for each and every MCQs has been given. So a video recorded detailed explanation is given. Also, you can compete in live tests and quizzes, and you can assess your weak areas. You can assess how to improve that area, and it will give you a healthy environment of competition. Coming soon is that if you are going to take 1 year of plus subscription or more than that, you will definitely get, we are coming up with the printed notes provided for the plus subscribers. So these are the benefits which together make it superior, much superior than the special platform or free platform. So just take the subscription, use my code and add 10 to get 10% discount. I would also like to tell you about iconic subscription. When I am talking about iconic subscription, it is the merging of both the two platforms. Best platform is merged together. One is the live class sessions, that is Unacademy Plus platform, along with the prep ladder, where the recorded video versions are there. All the clinical and essentials are there, integrated versions, video lectures from the dream team of the prep ladder. QBank 3 can be assessed by the active guidance, systemic tags and the MOOs. Rapid revision, Treasure 2021 dream notes. All these can be assessed by you in iconic subscription. So if the students who are targeting NEET PG exam, who are targeting next exam, who are targeting INICT, so definitely go for the prep ladder and iconic subscription, that is prep ladder merged with the plus subscription of Unacademy. So that should definitely take the iconic subscription, where they can get the benefits of two platform. Okay, so also FMG students can go for it, and both platforms are extremely beneficial. First year, second year can take the plus subscription of the Unacademy platform. So I would also like to tell you about the batches which are started. Focus FMG batches, Target Next 22 batch and the Target NEET PG 21 batch. So these are the batches which is on the platform of Unacademy. So do join and enroll in this batches. Use my code and add 10 if you want to take the subscription of Unacademy. 1 month package, I would like to give the information about 1 month package. This 1 month package is extremely beneficial. So you can have an ultra fast high revision batch, emergency room MCQ batch, NEET PG test analysis batch, last 3 year NEET PG previous year questions, COVID test batch and grand test series batch. These are the NEET PG 1 month package which can be assessed by you, and you can use my code and add 10 to get 10% discount. So the students who have already gone through and have got an revision has been done for 2 times, 3 times, they should take 1 month subscription and get an ultra fast revision of all 19 subjects. Now, I would also like to give you the information regarding highly effective QBank series of Unacademy. So, more than 25,000 MCQs are there, clinical MCQs of all 19 subjects based on latest pattern of exam, and include a detailed explanation for each and every MCQs. Use my code and add 10 to get 10% discount. I would like to show you the grand test series schedule, which is shown here, and the dates are there, and the timing is 9 AM to 12:30 PM. So before your main exam, just go for this practice of grand test schedules and series, highly beneficial. 4-year subscription, as I told you, Unacademy is coming, is already for the past 2 months, the 4-year subscription is there, and you can either take the plus subscription 4 years for 60,000 and 75,000 for Iconic. Extremely useful for first and second year students, because they can clear their prof exam and ultimately they can also clear their next exam. So go for it. Okay, and if you take 12 months of subscription, 2 months of subscription is absolutely free to you. Utilize this benefit. Use my code ANAT10 to get 10% of discount. 1 month subscription at a lower cost of just rupees 450. Use my code at rupees of 4500. Use the code ANAT10 and get a discount of 10%, that is 450 rupees. Okay, at the end, I am very proud to share the star learners of the platform of Unacademy, those who were present in the Plus course, and that is Dr. Rozim Patel, Dr. Gayatri, Dr. Neha Singh, Dr. Anudip Mohan, Dr. Subham, Dr. Dipti, Dr. Eliza, Dr. Arun, Dr. Siddhartha, Dr. Muku Vinod and Dr. Pooja. So they have cleared their exam with flying colors and with a very good and high marks. They were the students of Plus subscription. So I want to congratulate them and introduce and want to share their photographs and the name with you, because this will also boost your preparation. And all the best, all of you, for your future tenures. Use my code ANAT10 if you want to take the Plus subscription. Now, my dear aspirants, before ending the session, what I want you to show is the NEET PG and Iconic subscription comparison. So here is the comparison of 3 years and all the between the Iconic and the Plus, which is exactly not very apart in terms of pricing. Just so if you want, you can go for Iconic subscription, and the students of first and second year should definitely take 3 or 4 years of subscription. Students of third, fourth year pre-finals can go for 2 years, 1 year or 1.5 year subscription. Use my code ANAT10 to get an opportunity of 10% discount. All the best, keep studying. Thank you so much. So we will again meet. So now itself I'm going to start now itself I am going to start from the timing. I want to discuss the timing with you. So yes, it's going to be 1:25 and 1. So I am at 2 p.m. So exactly at 2 p.m. exactly at the timing of 2 p.m. I am going to start the session of pterygopalatine fossa. So all of you do join me for the session of pterygopalatine fossa. Do revise. You have already taken the notes and all the important aspect, boundaries, communications, and the clinical aspect and the details of maxillary, artery, mandibular nerve has been discussed in this topic. So those who have missed out also do attend the session once more. The recorded version will be lying there. So revise it. All the best, keep studying, and join me exactly at 2 p.m. for the session of pterygopalatine fossa. Okay, so the students who are still present should join me for 2 p.m. session. Thank you so much. All the best and keep studying. Thank you, students. Thank you.